Hello and welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN. Today, during episode 59, I'm going to talk about hypothyroidism and non-cardiogenic pulmonary edema and how that relates to celiac disease and potentially non-celiac gluten sensitivity. Stay tuned. Hi, I'm Nadine, the Gluten Free RN. Welcome back to the Gluten Free RN podcast, and welcome to all the new listeners from around the world. Today, during episode 59, I want to talk about hypothyroidism and non-cardiogenic pulmonary edema and celiac disease. Now, when I first say that, it sounds like three very, very different issues, and how can they be all related? Well, come to find out, they potentially are. Now, please do understand that I am a nurse and I am going to give you information, but you really do need to work with a qualified healthcare provider that can evaluate you in real time and help you figure out really what is the underlying cause for some of your issues. So having said that, I am going to talk for this episode of the Gluten Free RN about hypothyroidism and pulmonary edema. How potentially those are related to celiac disease is very interesting. And of course, one of the reasons that I'm interested in this is because, come to find out, this is what has been happening with me. But as an emergency room nurse, I have to say, never would I have thought that somebody that came into the emergency department with pulmonary edema had an issue with their thyroid. And certainly, if somebody would have come in with pulmonary edema and said they had celiac disease, I would have had a difficult time making that connection systemically. So today we're going to make that connection. Today we're going to talk about how this can all happen and how it's all potentially related. And interestingly enough, as a nurse in the emergency department, the endocrine system was never my favorite. It was never my forte. I was never an expert in the endocrine system. The endocrine system being all of your glands, or your pituitary, your hypothalamus, your thyroid gland, your adrenals. Those were not my focus in the emergency department, believe it or not. There were certainly things that we did look for as far as your hormones went, or your endocrine system, that were emergencies, and we dealt with those. Overall, I really still did not have a full grasp of the endocrine system or the thyroid even. It's all very convoluted and everybody's different as far as how they present with symptoms. And so it was never really anything I wanted to be an expert in. I was more than happy to have someone else actually take care of the patients that had severe endocrine problems, although I did know how to do it. It just was not my favorite. It was also a joke amongst the emergency nurses that if you were not good in something, or you were trying to avoid a topic or a specific group of patients, you would end up having a lot of them. Well, guess what? Here I am, an expert in celiac disease, and I have a lot of patients that deal with thyroid issues. The vast majority of the patients I deal with have some type of thyroid disorder. I myself had Graves for a number of years. And once I went on a gluten-free diet, my thyroid seemed to settle down, and I really thought that I did not have any thyroid issues anymore. My edema went away, my weight gain went away, my hair stopped falling out, and once my intestines healed, my body reached a level of homeostasis, which it had never even approached before. I did mention in a couple episodes ago that I did get hit with gluten 3 times, and come to find out, ended up being diagnosed with hypothyroidism again, which is not uncommon. But then I also found out that hypothyroidism can cause pulmonary edema. And because I have celiac disease and my thyroid was affected, it makes sense that the pulmonary edema then was caused by the undiagnosed hypothyroidism. And I developed hypothyroidism despite being on a very clean paleo-type diet, but I did get hit with gluten those 3 times, 2.5 years ago. So another great reason never even to accidentally get hit with even that breadcrumb of gluten, because it can trigger you into another cascade of potential signs or symptoms that will be difficult to figure out. Even as a nurse, even with a huge background in emergency medicine and celiac disease, I had a hard time figuring this out, and I could not do it by myself because it all seemed unconnected. But the reality is, it's really connected, all of it. It is difficult to get endocrinologists in general to be aware that gluten does damage the thyroid gland and affects the hormonal system and basically the entire endocrine system, depending on how gluten affects your body as an individual. For the last 2.5 years, my hair started falling out again really bad. Even in the shower, when I was blow drying my hair, I would end up with a carpet of my red hair all over the floor. I could actually feel my hair falling out, which is a weird sensation, and I'm glad that's gone now. I also had bilateral lower extremity edema or bogginess. I did not really have pitting edema anymore, but there certainly was that weight gain, just that bogginess of fluid retention. And my sinuses have been congested for the last 2.5 years. So people ask me if I have a cold or allergies, but really, you can't have a cold for 2.5 years. I highly recommend that you don't. And also this annoying, very concerning pulmonary edema. Now, pulmonary edema is where your lungs fill up with fluid. I also developed asthma, not even exercise-induced asthma. It just would happen. I would be sleeping and suddenly my lungs would get tight and then my lungs would fill up with fluid. What the heck was causing all of this? And not only that, for 20 plus years, I have had a rash on my right lower leg, and I've talked about that before. In hypothyroidism, it's very common, or myxedema, to have a pretibial rash. Pretibial meaning in front of your leg. And it was on my right leg only. I just considered that to be dermatitis herpetiformis that never really cleared up. And trust me, I definitely tried everything. Lotions and potions. I would slather honey on it. I would try poultices that were made out of herbs. It wasn't until I went to Thailand after the International Celiac Disease Symposium and saw an acupuncturist in Chiang Mai. And I, just ran down my symptoms. She took my pulses. I got a very gentle form of acupuncture from her and also cupping. On the way out the door, she gave me a very tiny tube of what she called damp rash lotion. I have no idea what is in it, but within a week of that treatment, my rash was clearing up. I could breathe. I no longer had to use my inhaler, and I felt better overall. That lasted for 4 weeks. So I got back home to the United States, to Oregon, and within 4 weeks of that treatment, my symptoms were all back, and the rash was back. I was not happy. I managed to get more lotion from Chiang Mai through friends. Huge thanks and shout out to Renee, who's a nurse practitioner. Her son actually got it for me and mailed it over from Chiang Mai. So I now have a supply of that. And I am working with an acupuncturist here in the United States to see if perhaps this particular acupuncturist can find the same type of trigger points or treat me for my underlying issue of the thyroid disorder. And I will mention that over the last 2.5 years, I really was trying to get my superpowers back that I had experienced before I was hit with this gluten 3 times. I was climbing mountains, I was hiking, I had more energy than I'd ever had. My body composition was enormously better. I lost all that weight that had been bogging me down, and I was not toting around water weight. So my body was much better prior to getting hit with the gluten, but then over the last 2.5 years, when I had to deal with all these extra symptoms and things that didn't make any sense on the surface, I tried things like the Whole30 and an elemental diet. I fasted for 4 days with water only. I did many different things because I'm my own experiment, and I wanted to see if there was anything I could do with my food or with things I had available to me to help me feel better. Now, interestingly enough, I had my TSH drawn during this 2.5 year period of time. my TSH has always been within normal limits. My thyroid labs overall have been within normal limits my entire life. Now, that despite the fact that I had Graves' disease and clinically, my thyroid was a mess. I had every symptom for hypo and hyperthyroidism, but on paper, my thyroid looked great. My labs always looked normal. So recently, my doctor ordered a TSH level, would not order a thyroid panel unless that TSH was outside normal limits, which it wasn't. So I called back and I said, hey, this is why I would like you to order the free T3, free T4, and a few other labs, the TPO, and a couple other labs that are associated with your thyroid. He declined to run those labs for me because he said my TSH was within normal limits. In explaining to the nurse, because I didn't talk to the doctor, that my TSH has been within normal limits in the past, but I really was looking at the finer points of my thyroid. But he again declined to order these lab tests. Now I have to decide whether I'm going to stay with this doctor or find one that will actually work with me and not treat me as a cookie cutter patient, because I'm obviously not. And you're not either. So find a practitioner that will actually work with you. Another thing I found interesting, and which does make sense, it also is part of the entire puzzle and why we have to think in a much bigger picture for all of these things like hypothyroidism and non-cardiogenic pulmonary edema, along with celiac disease. My thyroid was low, on the low end of normal. It was approaching hyponatremia. So normally, sodium should be between 135 and 145. It's a major electrolyte. It's one of the electrolytes that helps maintain our body's pH. And if our pH is out of whack, either too acidic or too alkaline, we have a hard time living. So we really want to maintain these electrolytes in a very narrow range. So my sodium was at the very low end of normal, which was interesting because normally I am a pretty big salt eater. I'm not afraid of salt. I crave salt. But here, my body was having a hard time holding on to salt or maintaining my electrolyte balance. And interestingly enough, if your electrolytes are lower, if you're having a hard time maintaining your sodium level, then you have fluid shifts, which can make the fluid in your body go out of your vessels and into your tissue. It's called interstitial edema or third spacing. But if you have a leaky gut from celiac disease or non-celiac gluten sensitivity, your other epithelial tissue are also leaky. So you have a leaky blood-brain barrier, you have a leaky lung tissue, and leaky blood vessels, henceforth the edema. And because you have celiac disease, you're going to have other deficiencies in things like zinc and iron, all of which affects your thyroid. So they are all potentially connected. Unfortunately, I've had people go to the emergency department with things like pulmonary edema or difficulty breathing, and that has not always gone well for them. If we don't actually put all the pieces together, then it's hard to treat people appropriately. People with pulmonary edema, if we're not looking at their thyroid, then it's a huge missing link in their health. We need to consider that the thyroid affects every organ in our body, every body system, and every cell in our body. So we want a healthy thyroid. I've included several research articles in the podcast notes, and I'd like you to look at them. Keep in mind, number one, that I don't agree with everything that's in the research articles. And just for an example, in the current allergy and asthma, celiac disease and autoimmunity review and controversies from May 17th, 2013, just even in the introduction, it says, it has been identified throughout the world, with the exception of sub-Saharan Africa and East Asia, that celiac disease is one of the most common chronic conditions affecting mankind. Now, we know that celiac disease is actually in sub-Saharan Africa and East Asia at this point. Celiac disease is a worldwide issue. It doesn't matter where you live. If you are a HLA-DQ2 and or a DQ8 gene carrier and you're eating grains or wheat, barley, rye, and oats, then your susceptibility to celiac disease is enormous. So it's currently rated that at least 1% of the population has celiac disease worldwide. Additionally, in that same article, it says the association between celiac disease and thyroid disorders is well documented. Of course, we know that, but we'd like every endocrinologist to know that. Many studies confirm an increased prevalence of autoimmune thyroiditis and Graves' disease within adult and pediatric celiac populations. So it's very important for all physicians, all primary care providers, all specialties to know about celiac disease because it's very common. But overwhelmingly, what I find out is that a lot of practitioners are unaware of how prevalent celiac disease really is, and that it is the number one miss and undiagnosed autoimmune disorder in the entire world. So it's very important we get on that. As I've said before, I would like us to do a mass screening, a worldwide mass screening for celiac disease, especially in light of the fact that we have many epidemics around the world that are not going to go away until we deal with the underlying issues, which if celiac disease is undiagnosed in almost every country of the world, then we really need to get on that and prevent it because it affects everyone's quality of life. And it is very important to recognize early so that people can quickly adopt a gluten-free, hopefully dairy-free diet, if not just a whole food paleo-type diet. And if you're vegan or vegetarian, that's fine. We just need to work in those parameters so that you have appropriate nutrition so that your body can heal. So as a recap, let's just say that your thyroid is affected by the gluten. Once you have a leaky gut, the gliadin protein can affect the thyroid gland. Your thyroid gland has a bullseye on it for that gluten protein, and I'm not sure why, but for some reason your thyroid is especially vulnerable to the gluten and the gliadin proteins that are in wheat, barley, rye, and oats. So if anyone that has any thyroid disorder, I don't care if it's hypothyroidism, hyperthyroidism, Addison's, Graves', Hashimoto's, any autoimmune thyroiditis, they should be tested for celiac disease. And now that we know that pulmonary edema or edema in general or mixed edema are possible connections to celiac disease, that number one needs to be studied more. And number two, anyone with unexplained non-cardiogenic, which means it's not congestive heart failure, maybe we should include those people too, with pulmonary edema need to be tested for celiac disease proper and also have their thyroid appropriately examined and tested. And many of the thyroid disorders are tested for a baseline, and then many practitioners are also treating those patients empirically, which means they are treating these patients based on their symptoms, their presenting symptoms. There are lots of symptoms associated with hypothyroidism: puffy face, constipation, fatigue, muscle weakness, muscle aches and pains, irregular menstrual periods or delayed menstrual periods, thinning hair, hair loss, slower heart rate, hypothermia or a decreased temperature, body temperature, depression, and memory problems. Many of those symptoms can be directly connected with celiac disease or so many other things. So we have to have an open mind about connecting all of the dots for ourselves and for our patients. This is another big topic that we're tackling today on the Gluten Free RN during episode 59. I hope this has been helpful and that the references that I've included in the podcast notes are helpful for you. Please feel free to leave a comment or a review and a rating on iTunes or Stitcher, Google Play, or wherever you listen to the Gluten Free RN podcast. And thank you to all the listeners of the Gluten Free RN podcast around the world. Several of you have reached out to me, most recently Tiffany, who's also a nurse in Canada, and I really, really appreciate the connection and the phone calls, the emails that I get. So maybe we can make significant progress in educating people about celiac disease and non-celiac gluten sensitivity, both for practitioners and for the general public. So keep those comments coming. I read all of the ratings and reviews, and thank you very much in advance for doing that. This has been episode 59. We've talked about hypothyroidism, non-cardiogenic pulmonary edema, and celiac disease. This is another big topic, which I'm sure we're going to have to talk about again in the near future. But thank you so much for joining me, Nadine Gruskowiak, the Gluten Free RN. Be healthy, eat well, and until next week, stay healthy. Bye.